What is up, everybody? My name is Dr. Mark Murdoch. I'm a chiropractor with a master's degree in sports medicine. And today we are talking about shin splints. So shin splints is a pretty common problem. It's a lay term that we tend to hear for something called medial tibial stress syndrome. Really common in runners. I call it the runner's plague. We're going to talk about everything from where it comes from, why it happens, what parts of the body are affected, and then what to do about it when you actually get it. So if you don't know who I am already, welcome to the video. And if you're listening to the podcast version, no, there is a video version. You're not going to miss anything by listening to it on the podcast. But on the video, you'll have a couple kind of bullet points to watch. If you want a little bit more of a written out version of this, you can go to basecampclinic.com and look up the shin splints blog post. There's going to be tons of information on shin splints, everything from diagnosing it to what to do if you have it, basically everything that we're going to cover in this video. So welcome. So we're going to talk about shin splints, which I call the runner's plague. It's extremely common, especially in new runners or anyone who changes their running volume. So we're going to kind of talk about why that is. But the very typical pattern is you get a new runner or you just start into running and you're building up your volume. You're starting to kind of figure out like what this running thing is about and why so many people are into it. You're finally starting to get your groove. That's getting anywhere between like 3 and 6 weeks from starting. This also happens in experienced runners when we're getting back into the season and you start building up your volume. But usually you're going steady for a few weeks. You're building up your mileage. Maybe after 3 or so weeks, you're up to 25 miles a week. You're running like maybe 5 miles every few days, and you're feeling pretty good. And then all of a sudden it hits you. You get this kind of really achy and really kind of annoying pain on the front of your shin, and it just drives you crazy. It's not too bad when you rest, but as soon as you start running again, it spikes back up. And there's this just kind of this pattern where it increases, it decreases, it increases, it decreases. It's not too bad for the first couple miles of your run. You get into, mile 2, mile 3, and then it starts again. It kind of goes away after a little while. And then after, a couple of weeks of having the shin pain, now it's every single time you're running. After a couple miles, it hits you. It doesn't go away. It gets worse and worse. As you rest, if you stop running, you do notice that the pain starts to go down. But as soon as you start running again, that shin pain is back. Very common pattern. Like I said, we usually call this shin splints, but in my world and the more clinical world, we're going to call this medial tibial stress syndrome. So that's basically a fancy way of saying that it attaches to the tibia, which is your shin bone, and then it pulls on that bone and causes what we call inflammation. So it's where that muscle actually attaches to the bone. Now, when we typically think about muscle, the kind of prototypical example for a muscle is often a bicep. So if you picture the bicep in your mind, you might picture like a bag with ropes on each side, and the rope is attached to one anchor on one side and one anchor on the other side. So your bicep attaches to the shoulder, and then it attaches to your forearm, and it pulls your forearm towards your shoulder. Okay. The difference in anatomy between the bicep and the shin, so the arm and the shin, the muscles involved in shin splints don't attach to one anchor at the top like they do at a bicep. So it's not like it just kind of hooks onto your shoulder like it does the bicep. The muscles that attach to your shin attach the full length of your shin. So it's almost like a curtain on the top. So it's attached kind of all along that anchor. And then it usually feeds down into a little bit more of a thin bundle of muscle that's a little bit more like that rope. And then that rope kind of feeds under and around the ankle, and it attaches to the foot. So the place that gets inflamed and irritated is all along that shin, or the kind of the top of that curtain. If you can picture like a window curtain, how it attaches kind of along the full top of the window. When we're running and we're increasing our volume, every step that we take, those muscles are pulling on the top of that curtain or on that shin, on that bone, on that anchor, and that can eventually lead to inflammation. Okay. If shin splints is left untreated, this can progress to what we call a stress fracture. So a stress fracture is a fracture caused by repetitive trauma. So the stress of the muscle pulling on the bone when the bone doesn't have time to heal. These are really hard to see on x-rays and on imaging, and we're going to talk about that later. But stress fractures they're a really bad time. They're a lot harder to deal with than just shin splints, just the stress syndrome, because inflammation is a lot easier to deal with than an actual fracture. And we'll talk about some strategies for that later. So you don't want shin splints to progress to an actual stress fracture. We want to catch it before that. So if you are getting that pain that 3 to 6 weeks, the beginning of your kind of training season, we definitely want to dive into it and figure out how to manage it. So how do you know if you have shin splints? So if you go into a chiropractor or a physical therapist, we're going to look at a couple things. We're going to do a history, and then we're going to do a physical exam. History is where we take basically a bunch of information from you. We ask you a bunch of questions. It feels like we're grilling you for information. And frankly, that's because we're trying to figure out what causes your pain to kind of direct the physical exam, or what the story is leading up to your pain. So really typical things that we'll learn from the history when we're asking you questions is pain along the medial side of the shin. So basically close to your midline. The pain that increases with activity and lessens with rest is a pretty typical pattern. It's not always the case, but most commonly it is. And usually shin splints involves a recent increase in running volume. Now, that's not always the case. There could be other stressors in your life that change how you're responding to that volume. So even if you've always done 15 kilometers per week and you've done it for years and years and years, never had a problem, but you've been really, really stressed the past 6 weeks or so, that alone in itself can be a factor that can lead to basically compromising your ability to heal, which can then lead to shin splints. The other thing that's pretty important for us to know is if you've had a history of shin splints before. So maybe, you've been running, you're a 10-year runner, you've been running for a long time. And and like the first couple of years, I had shin splints pretty bad. I was pretty good for a while, but then, I've been doing more mountain biking. And now I've come back and I'm getting shin splints, or I get symptoms that feel like shin splints again. These are really important factors for us to know in the history. And then on the physical exam, what we're generally looking for is we're trying to rule out anything worse. So we're trying to rule out a sprain, a fracture, anything that could masquerade itself as shin splints. But generally what we're looking for, number one, is pain that's reproduced with something we call palpation, which is basically where we apply direct pressure on the muscle or bone. And then if we can recreate that and it doesn't seem like it's anything else, then we're going to go ahead with the diagnosis of shin splints, or again, medial tibial stress syndrome. So how to treat shin splints. So shin splints is essentially a recovery problem. So you're not recovering from the stress you're putting on your body. So generally, I take a two-step approach to it. Number one, or the first goal, is to manage the symptoms. So we want to get you out of pain, or at least decrease pain as much as we can. And then number two, we're going to try and eliminate the actual cause of your shin splints and of your pain. Okay. Number one, so that goal, manage symptoms. There's a bunch of ways to do that. Number one is relative rest. That's going to be by far the most important for shin splints. Number two is probably actually maximum recovery. So we want to maximize your body's ability to recover from the stress you're putting on it. And then we'll use stuff like manual therapy. So in my world, we'll use some adjusting. We'll do some kind of muscle release technique. We'll do some stretching, that sort of thing. We'll also sometimes use some modalities, ice, heat, topical analgesics, so biofreeze, lidocaine gels, that sort of thing. Sometimes we can use tape, and that's helpful. Some PTs will use needling. Sometimes that can be helpful for different people as well. But then really the goal at the end of the day is to eliminate the cause. So when it comes to shin splints, the number one cause is your inability to recover from the stress you're putting on your body. So that inflammation, which is actually a good thing. Inflammation is a good thing if it's for a short period, but if we can't recover from that inflammation, then we're in for a bad time. So as a general rule, you're going to want to manage about 10% increase in volume per week. So if you are running a 5K pretty much every week. You don't want to jump up to running 3 5Ks every week. So instead of doing that, you put a 10% increase in volume. Now, not always volume. It's not always running distance. You can also do running time. So if you run 20 minutes a day, 3 days a week, start off by running 22 minutes a day, 3 days a week. And next thing you know, the next week you're progressing another 2 or 3 minutes. Next week you're progressing another 2 or 3 minutes. And all of a sudden you're up to an hour 3 times a week, and you haven't progressed to or developed the symptoms of shin splints. The other thing that we want to do is we want to maximize recovery. So number one thing for recovery is going to be 8 hours of sleep, at least. Your body needs to recover from the stress you're putting on it. And it doesn't do that without that recycling cycle of sleep. That's when your body heals physically, heals mentally. It's super, super important. Hydration is a good one. If you are poorly hydrated, it'll change your body's ability to send all the nutrients throughout your body to the healing regions. Nutrition is an important one. Make sure you're getting enough protein. Make sure you're not under feeding yourself. So if you are trying to lose weight, this is a good point to have. You want to make sure that your calorie deficit is not so large that you're not recovering from the day. So you want to make sure you're feeding your body enough nutrients to actually build up the blocks that you have actually damaged throughout the day, because exercise is damaging, and then we recover that at night. A bonus one, vitamin D can be pretty important for bone health. North America, most of us are vitamin D deficient. Definitely check with your healthcare provider before adding vitamin D, but vitamin D can be helpful in recovering from any sort of bone issue, but just muscle and joint injuries in general. And then active recovery. So trying to be moving on your off days rather than just sitting down, not necessarily running and loading up everything in the gym, but going for a walk, walking the dog, a really light hike, maybe a light cycle, that sort of thing. That can all be really helpful. And then secondary on our eliminate the cause, we're going to try to improve the biomechanics. So maybe improve your ankle range of motion, your foot control and foot strength. And then we also want to build resilience. So we're going to improve your leg strength. We're going to improve your foot strength, your hip strength, and just slowly build up your body's ability to manage the running volume. A really common question that come up is, do I need an X-ray for shin splints? And the answer is maybe. So the problem with stress fractures, especially if they're new, they're really hard to see on an X-ray. Do we want to X-ray if we suspect a stress fracture? Yes. So that's where you'll work with your doctor or your physio to decide, like, is it an X-ray necessary? The caveat to this is, even if it is a stress fracture, we're not going to change the treatment that much depending on the severity. Now, we may change it a little bit, because we may actually splint the area. We may put you in a boot depending on where that stress fracture is and how quickly it's progressed. But as a general rule, if it's shin splints and not a stress fracture, which we won't know unless we take an X-ray, but depending on the severity of symptoms, the history, and how well you've been doing with recovery, so a trial of care, my tendency is to not X-ray unless I absolutely need to. So will you need an X-ray? It depends. It's not a great answer, but that's where you have a conversation with your clinician. If you're super concerned about it, there's not a high risk of taking an X-ray, but there is a cost of time and sometimes financial cost, and sometimes it takes a long time to get into an X-ray. So just some things to keep in mind. The other question that runners hate to ask, or the sentence they hate hearing, is you have to stop running. So with shin splints, do you have to stop running? Maybe not. That's going to depend on a lot of things. It depends on how quickly you seek care, or how quickly you implement some of the measures that I've described already and that we'll talk about a little bit later. It also depends on your running history, your injury history, and then what you're running for. So if you are a track athlete running to compete in high level track, do you need to stop running? We're going to do everything we can to keep you at a competitive level. Okay, so that means that we're probably going to pull back on the running at least a little bit, but we don't necessarily have to eliminate it completely. Now, if you're someone else who is, you don't actually like running, you're just running for weight loss, do you need to stop running? I'd probably say yes, because we have so many other modalities that we can use. We can use cycling, we can use rowing, we can use the stair climber, etc., to still meet that goal. Now, depending on the severity of the shin splints, I might recommend that my athletes stop running for a period of time, especially using a relative rest strategy. So they might not stop running completely, but instead of running a 10K without stopping, we might be running to sub-symptom threshold. So if you are pretty dialed in on your running volume and you know every time I hit 32 minutes, that's when my symptoms start. Awesome, perfect. We're starting out at running for 30 minutes for a couple of weeks. And then next week, we're going to add on 10%. We're going to go to 33 minutes, or maybe we might be a little bit more conservative than that. And we're going to see, is that symptom threshold, has that improved? Is that now 35 minutes before the symptoms come on? And we're going to keep building up sub-symptom threshold until we're back up to a running volume that is tolerable and recoverable by the body. This is virtually impossible to do if you don't track your volume in some way. So Strava, Garmin watch, whatever you're using, try and use the same device over and over again. But in this case, it's generally helpful to be using some sort of volume tracking measure. That can even be just a notepad and paper and a timer. If you're old school, that'll work as well. But do we need to stop running? Not always, but we'll pull back on it in some ways. Okay, so the very first thing to do if you think that you might have shin splints is relative rest. By far the most important thing to do from my perspective. So you're going to cut back on the volume that you've been doing previously. Okay, that doesn't mean complete rest. That doesn't mean sit on the couch and do nothing. You can switch that up for rowing. You can switch it up for cycling. You don't have to decrease your total volume, but relative rest of the activity that is aggravating. The second thing to do, the second line of defense, are some exercises, vitamin D, ice massage, etc. Some of the other things that we talked about. These aren't as important as relative rest, but they can potentially improve your symptoms and your ability to increase your run in the future. Okay, so exercises that I'm talking about are usually going to be some lower limb strengthening and mobility stuff. We have some of the videos on basecampclinic.com. I think it's /blog/shin splints, but I'll put a link down here in the description and the show notes, so it'll take you right there, because there's a couple things that you can definitely start doing even while you have shin splints that can improve when you get back to running. Those are generally good ones to start with. Now, no one likes to hear this part, because this part is pretty humbling, and it doesn't matter if you're a clinician or a recreational athlete or a competitive athlete. Shin splints is not a fun one to recover one. So how long does shin splints take to heal? The research is varied, but it takes anywhere from 3 to 12 months. Now, depending on the person, that's going to be very different how long it takes to heal. And it also depends on what we qualify as heal. Because in this case, it's not necessarily a broken part of your body, it's an irritated part of your body. So if we're using the definition of how long it takes to heal, how long does it take to getting back to running like I was before? That can take anywhere, 6 to 12 months, depending on how far you progress, and depending if you've run on this for 6 months without seeking care and without doing any change to your volume. But how long does it take to heal? How long does it take to get back to running a 5-kilometer trail run one time a week, supplemented by my other activity? We can usually get back to that or something resembling that in kind of the closer to 3 to 6 months. It also depends on your general health. If you're dealing with a bunch of other things like really high stress, maybe you have some high blood pressure or like diabetes and stuff like this, that can definitely delay the healing process, but we can still get you back to being more active than you were before. Okay, so quick summary: shin splints, sucks. It's the runner's plague. It's not fun to deal with, but it is manageable, both with a team. So manage with you and your clinician, or you can start managing it on your own. If you are experiencing stress on the shin, so the basically the inside part of your shin, and it's increasing as you increase your volume, and you are getting relief when you do relative rest, there's a good chance that you have shin splints. If you think that you have shin splints, but you're not sure how to manage it, definitely seek out an assessment by a physical therapist or a sports-oriented chiropractor. If you want to chat with me, I'm always happy to chat with you. basecampclinic.com. You can shoot me an email. My contact info is on there. And then if we think it's appropriate, you and I can have a chat and see if we can manage your volume. And if you live close to me, so we're located in Vernon, British Columbia, then I can get you in for a face-to-face if necessary. And if not, if you're somewhere else, we got a pretty extensive network of clinicians that we can send you to. If you find that you're dealing with shin splints, give it a little bit of relative rest, try some ice massage, see if you can give yourself a little bit of relief, check out your running volume, and then slowly build back up to getting better, because the last thing we want is a stress fracture, because stress fractures, they suck. They're not fun. If you have any questions, hit me up, basecampclinic.com, and I am base.camp.doc on Instagram for some more exercises and advice. In the meantime, as long as you're not dealing with shin splints, keep hitting the trail and get out there, get outside.